Welcome, everyone, and thank you for joining us again this afternoon. My name is Rachel Smythe. I'm the Education Coordinator here at the Caregiver Resource Center, OC. Since 1988, the Caregiver Resource Center, OC, has been a trusted partner for Orange County families who are coping with the physical, emotional, and financial responsibilities of caregiving. And by providing families with individualized supportive services, the Caregiver Resource Center stands apart as the only Orange County agency focusing exclusively on the needs of caregivers who are coping with a loved one's chronic illness. The Caregiver Resource Center provides family consultation, support groups, assessment and care planning, counseling, respite planning, and community education. And here at the Caregiver Resource Center, we host a live stream each month. And this afternoon, you've joined us for our live stream, What is a Traumatic Brain Injury? And so today I'm joined by Dr. Daniel Ignacio, who serves as a UCLA clinical neuropsychology postdoctoral fellow. There's a lot coming your way, everyone. Daniel's very, very well qualified, and he's also a certified brain injury specialist with the St. Jude Brain Injury Network. Also serves as the elect vice chairman of California's Department of Rehab's TBI Advisory Board, and much, much more. I'm tired just thinking about all those different incredible things that you're doing. But thank you so much for joining us, Daniel. And I'd like to give you the chance to introduce yourself before we jump into some questions. And also for those of you who have joined us in our audience, whether you're on Facebook or YouTube, please feel free to ask questions or share comments with us throughout our time together. And so with that, I'll turn it over to you, Dr. Daniel, if you'd like to share anything before we get started.
Awesome. Yes. Thank you, Rachel. That was a very kind introduction. Yeah, and it's a pleasure to be here. Thank you for the invitation. As Rachel was saying, I'm the certified brain injury specialist, an LMFT here at St. Jude Brain Injury Network. We are in Fullerton, and we are fortunate enough to share a space with the Caregiver Resource Center. Also, as she was saying, finishing up my clinical neuropsychology fellowship at UCLA's Brain Sport program. And right now we are in the process of the largest NIH-funded study on concussion in adolescents to date. It's called Care for Kids study. And basically, we're trying to prospectively identify what biomarkers, right, that go into what percentage of youth will go on to experiencing persisting post-concussive symptoms following head trauma. And so these biomarkers are things like neuroimaging, blood samples, neuropsychological, cognitive functioning, headache, migraine subtypes, autonomic nervous system functioning like pupillary response and respiration rate, heart rate. If you or a loved one or anyone you know has someone who recently experienced a concussion and would like to participate in this growing and very important scientific endeavor, the website is care, that's CARE 4 KIDS study.com. And there are 6 sites all over the country enrolling youth who've just experienced a concussion, ranging from Seattle, Washington, D.C., Rochester, New York, UCLA, of course, Dallas, Texas, Salem, North Carolina. And again, that's care4kidsstudy.com.
Wow. I mean, the work that you're doing is just so incredible and so important. And, I feel like I learn something new every time I talk to you. So I'm just so glad that I get to talk to you today. Although it's kind of funny because we're both in the same building here, but in different areas. Um, and so I know you just shared about, this study that you're doing with youth. And then I know you also work with adults in a couple different capacities. So it sounds like you
Correct.
have experience across kind of the lifespan when it comes to different types of brain injuries, concussion. Um, and so I know you're doing a lot professionally um, within your role to serve this population, but I'm wondering if you're comfortable with sharing the connection that you have with our subject today on a personal level.
Yeah, absolutely. It's been a long time. So in 2008, I'm pretty comfortable. I'm actually very comfortable speaking about it. It's been a very long journey of self-discovery, and recovery and rehabilitation and connection, which I really think has been the foundation of my reintegration and my recovery. So in 2008, I was barely 18 years old. I experienced a 38-foot fall and spent a month in a coma. For those of you out there, my worst GCS or Glasgow coma scale was 3. And so living with a medically and clinically complicated TBI presented with physical and cognitive challenges that really exacerbated my already heightened feelings of vulnerability as a young adult. And so disrupted thinking, slow processing, misperceptions, these were daily experiences that really just served to further isolate me from my support systems. It facilitated avoidance, right? And I withdrew from, otherwise adaptive activities like, my support systems. And it really contributed to this belief that I had about an ambiguous self loss of identity. Um, like I was present, I was physically present, I looked the same, I was familiar, there's a lot of familiar things, but I was different. And it was a difference that I really couldn't fully mourn or really understand. Even to this day, I don't really fully understand it. I can just say a whole lot of words that are relevant. But so, I mean, ideally, I was really blessed to survive, though, as I do understand that. I mean, I'm one of the fortunate ones. There are tens of thousands of adults and children every year that lose their lives to basically the same thing I get the opportunity to walk around with. Um, and so I was blessed to survive, but I felt subjectively like anxious, depressed, constantly overwhelmed, and objectively as well. So there was encephalomalacia on my corpus callosum, which is the information highways that connect the left and right halves. And I have this weird hyperintensity thing on my prefrontal that's still there 2 years later. And so, but it's not growing, right? So if it's not growing, that means um, I can cut my loss and move forward. And so my family, both immediate and extended, both locally and internationally from the Philippines, they really formed a support system that really encouraged me to proactively engage. And even though I needed lots of guidance and direction in the very beginning, even though they didn't know what to do, it was still something I needed, and it's still something they provided to the best of their abilities. So, there were lots of trial and error, few successes, and many, many, many more failures. My sort of deep-seated sense of learned helplessness became a growth mindset. That failures are actually necessary to find what works, right? And we see those in caregivers, right? Having to adjust to a whole new condition, and the condition may be progressive. And so, depending on the time since the onset of the condition, will kind of change the needs. And so, clearly, the more I
Right.
failed, the more I learned, and the more I
I
adjusted.
love
And
And I love that perspective of, typically we associate failure as something negative, right? And you just said, the more
mm,
I failed at something, the more it was an opportunity to learn and grow. And I really genuinely want to thank you for sharing, Daniel. And just to once again, I know I tell you all the time, but I am deeply, deeply proud of you and to know you. You are absolutely incredible.
thank
So
you.
thank you
And
again.
admittedly, many of those adjustments that I did were misguided. Right, there were a whole bunch of things that I did that were wrong and misguided, and maybe in the opposite direction. But for the few that were spot on, I was able to begin my career as a mental health professional.
Right. And you're really just incredible. And you know so much. And so my first question is, so can you kind of explain? I know this is a big question to put into a short amount of time, but so what is a brain injury? And I think many of us are familiar with the terms traumatic brain injury, but I'm also wondering if you can
Mhm.
share a little bit about, are there other types of brain injuries? So what is it? And then
Yeah.
what kinds of brain injuries are there?
Yes, and so there is a confusion out there. So I mean, there is brain injury as an umbrella term, and then brain injury as an umbrella term could be further sparsed out into two real subcategories. One is acquired brain injury, and then the other one is like congenital. And so congenital is like present at birth, birth trauma, hereditary, those kinds of things, and that comes with its own unique nuances, and comes with its own unique recovery process and factors to consider. And so, really, traumatic brain injury is a subtype of acquired brain injury, and other it's acquired, essentially get acquired after birth. And then acquired brain injury subtypes include things like hypoxia, anoxia, loss of sufficient oxygen, like near drowning, or getting over anesthetized during a surgical procedure, um, or an overdose. Other things are cerebral vascular accidents is another one, and so that's like hemorrhagic or hemorrhagic strokes or ischemic strokes. And then there's things like infections or tumor resections, and that could be based on the kind of brain injuries. Is it from the swelling, from the inflammation, or is it from a tumor resection where it damaged some underlying brain tissue? And then, of course, the one there that we're talking about, the topic of today, is traumatic brain injury. And so, clearly, any any brain injury is clearly traumatic, but in this sense, traumatic refers to a blunt force, or it could be that penetrates the skull, or assaults the scalp. And so, common things are like motor vehicle accidents, falls is a big one, sports injuries, motor vehicle crashes, and being hit or struck against things. And depending on the age, there are certain age is a certain risk factor for certain different types. And of course, the one behind mine was an assault that led to a fall. And so those are the various types
Thank
that
you.
are
I
not
just
progressive.
learned.
Yeah,
Okay.
so I think that's an important piece. So it's not progressive. They're not inherently progressive. So, as we understand right now, of course, like as we look in more of like maybe there might be something that kind of goes like you get this secondary neurometabolic cascade that might be doing something, but w- let's just restrict down to the impact. And so the impact is not progressive in the sense that the injury or the tissue doesn't continue to decay over time. Um, and there could be cognitive disuse or environmental impoverishment that then secondarily leads to those, but um, essentially the impact itself is in and of itself not progressive. And so the good news, very, very optimistic news to that is like, yes, you have one brain, and it holds everything about us, and depending on where it is and how much damage, it could really manifest differing degrees of certain symptoms, either physical or cognitive or emotional or sleep disturbances. And so based on this, the impact, the damage into the brain can be essentially reconciled, and you can do things to increase adaptability, accommodation. You can, and then there's taking advantage of like neuroplastic changes where you can essentially rewire, or for a lot of things compensate and find ways to maintain and enhance independence for a lifetime.
I think that's really helpful to know too. And, many of the caregivers that we serve, we have many who are caring for a loved one who's experienced some type of brain injury. And so, some of these things to hear and learn more about it, oftentimes with many diagnoses, people don't know where to start, don't know where to begin, don't know how things are going to be impacted. And so I know you mentioned, these different areas that there may be a change in someone's functioning. And would you mind speaking a little bit more to that? In what ways can a brain injury impact someone's life?
Yeah, and so brain injury, right? And so the the difficulty, right? And so these are kind of the gaps, right, for TBI care, and it also riddles the TBI research, right? Which then, because the TBI research is limited, then the empirically supported treatments are therefore then also limited by the lack of research because of all of the variety, the heterogeneity in the presentations. And so, like we are talking about, the 3 pound massive cells between our left and right ears hold everything about us, like our memories, our talents, our interests. And so, while not completely discrete, right, there are certain areas that correspond with certain functions. And so, depending on, thanks to the National Institutes of Neurologic Disorders and Stroke, or NINDS, earlier this year, they worked on a reconceptualizing of uh, traumatic brain injury, um, from moving away from the mild, moderate, severe. So, like, we're stepping away from that kind of nomenclature and really moving towards more considering severity on a spectrum. And the severity on the spectrum, depending on the person and the environment and the setting, is the spectrum of risk for, dysfunctional outcomes, be it at independence, at work, at school, right? Medical complications. And so, how a brain injury can impact someone, I mean, real clear ways is, the NINDS is supporting to use like clinical markers. Did they lose consciousness? Were they in a coma? And that's really just to rule out more complicated TBIs. Then potentially looking at using blood biomarkers for as markers of inflammation, so like GFAP, neurofilament light, or GFAP, neurofilament light, and imaging markers. So, like I said, I have cell death on the information highways between connecting my left and right halves. And so it's there, and I have this hyperintensity here, like in the prefrontal, and it's large and it's still there, but it's not changing. And so those imaging markers may have and may indicate some difficulties that I have in like organization or planning, or being able to identify what things are, and communication within my brain. And then the most important, I shouldn't say that. In my opinion, what I find to be very, very important is the last piece, modifiers, right? So modifiers are what can you access? Socioeconomic status, where do you live? Can you access care? Do you have insurance, or do you have good insurance, or any insurance? And what are your support systems? And what's your day to day like? And do you have supports in that day to day to move you from where you are to where you ultimately want to be, moving towards independence? And so, going back to answering the question more directly, it can, depending on where it is, and so it could impact you physically, right? So some common ones are headache, light sensitivity, sound sensitivity, cognition, those things like feeling foggy, or like head pressure, attention, concentration, short-term memory loss, right? Not so much long-term memory loss. And then there's sleep disturbances, either getting to sleep or staying asleep, initiation or maintenance. And then there are emotional. And so those are things like feeling emotions more intensely, paroxysmal anger, or paroxysmal aggression, or anxiety or depression. And so, considering all of these domains of possible symptoms, uh, TBI is, it's a textbook neuropsychiatric condition that encompasses so many different things, and because it's so varied, it's gonna need it absolutely requires a multi, if not interdisciplinary approach, right? It's not, the answer isn't going to be in one place or one person or one thing, right? It's going to need support, wraparound support, right, to really move the survivor from where they are to slowly back to feeling to baseline, and then um, reintegration. And then at that point, hopefully protect so they don't get re-injured.
Absolutely. And so you mentioned some really important things, I think, for anybody who's listening or will rewatch this, who either they themselves have recently experienced a brain injury or they have a loved one who has. And, you mentioned this idea of this multidisciplinary approach, how, these different areas can be impacted. And so what types of services or what types of questions, what types of things should somebody who either they or their loved one was newly injured, where would you encourage them to start?
Yeah, this is a great question because I just had a client come in today who just had their head injury or a head trauma and brain injury within the last few weeks. And so uh, came in wanted to understand his unique constellation of symptoms, what were kind of the things that they're feeling, and then from that point, if there's eye pain, right, we starting to understand, well, is it physical eye pain or is it the eye not being able to focus? And so it's either neuroophthalmology or neurooptometry, depending on whether it's the physical entity or the function, the anatomy or the physiology of the eye. And then trying to identify, consult with your neurologist. We want to make sure we just, like we talked about earlier, we're trying to rule out more serious conditions. Like, do you have any image? Are there anything in your imaging or is it unremarkable? Do you have, any fractures? Do you have any lasting medical things that could contribute to the complications moving forward? And then what's the extent of the cognitive things? And so, this particular client came in and we're able to do some cognitive screens in here. And it was right there. It was just doing cognitive screens. We were able to check this out, this checks out, da da da, and then we're able to really hone in. So like, there's the medical piece, right? So that could be with your general GP, a physiatrist, who is a rehabilitation physician, or physiatrist, depending on how you say it. Then there could be a neurologist. That's an important piece. And then if you're having pain, what kind of pain is like physical therapy, PT, OT, ST, occupational therapy, speech therapy. And then there's cognitive therapy. And so, which is traditionally has been under the auspice of speech therapists. But for additional cognitive training and additional connection of cognition and generalizing to their everyday, they may want to connect with a counselor or a psychologist, a neuropsychologist to evaluate them cognitively, objectively using tests, and they can integrate all of their different medical records to identify, okay, you have this from neurology, you have this from physiatry, you have this from PT, you have this from OT, being able to integrate all of those things. And then ultimately, the most important thing is moving to a person-centered approach, right? What does the person, right, and in the person people field, right? We're always wanting to move things toward client-centered. And so, what are the client-centered goals? And because for some of them, I mean, they want to return back to baseline. For others, like myself, I want nothing to do with my old self, right? And so, um, right, and so those are certain aspects that we're trying to integrate all together, right? And then once we can integrate all those pieces, it's not gonna be perfect, of course. So we kind of just take our best estimate and then take steps, and then it's gonna be that trial and error process, right? Where we're gonna have to move in a scaffolded way, and then because there are some things that's going to be easier, some things going to be harder, and then so ultimately we're going to move in a scaffolded way to a client toward a client-centered goal, in a manner that I always like to think of. Dr. Thomas Insel, previous director of the National Institutes of Mental Health, said, "True rehabilitation needs the three P's: person, place, and purpose."
Oh, that's very powerful. Very powerful. Thank you
Absolutely.
for that. I just added a fourth P. So, um, and then for so if somebody's feeling just kind of overwhelmed with this process, right? Because it's a lot, and they're
It
already
is
going through a lot of different things. So I was wondering, I know you also work with St. Jude Brain Injury Network here. Um,
correct.
what type of services are offered, or would that be a good place to start if you're feeling kind of overwhelmed? Would Brain Injury Network be a good place to call and ask, I'm not sure where to go from here? Can you share a bit about that?
Absolutely. So we would be the perfect place to go, right? Because the whole idea there is the care journey of TBI is it's not continuous, it's not smooth, it's not glamorous, it's not glitzy, right? And so at so many different points, it can become overwhelming, and there are inherent gaps, right? Just in the care system, right? If you go from, so if you're medically or clinically complicated enough to even go to a hospital or to a medical center, which not everyone does, right? So and even if you have like the means to even access care, right? Because some people don't. And so you go to post-acute care, then once you're medically stable, then you shift maybe to subacute care, and then post-acute care, then you go outpatient, right? And then community reintegration. And so in those distinct classifications across the rehabilitation continuum, there are gaps, right? And if there's not a warm handoff and you're not careful, you could fall through and then find yourself floundering. And so at St. Jude Brain Injury Network, what we do is like we're not gonna do any PT, OT, ST on you. We're not gonna do any surgery, but we can help guide throughout the process, help with advocating for services, advocating for accommodations, advocating for needed benefits that you need, right, with Social Security or with your employer or at school, right, and then we'll kind of help coordinate and case manage in a certain way. So that way, all the things, all the questions, I mean, of course, we're not going to say that we have all the answers, but we can help you inform your next move toward recovery and reintegration. And so I welcome anyone who is struggling or maybe confused, even just a little bit, right? Just a little bit. Either yourself, a loved one, or someone you know, maybe a neighbor, right? Be a good neighbor. And please reach out.
Awesome. Thank you so much. I think that's really helpful because oftentimes we just don't have that guide or just where to start, and it feels really overwhelming. So to have a place that can be called to ask these questions, get more information, and at least get pointed in a good direction, I think is invaluable.
Yeah, I mean, brain injury, right? It's sensationalized in the media. It's scary, right? We have all these things like, oh, like we're gonna get CTE things, and so a lot of those brain injury things are they're sensationalized, and really to
Mhm.
let you know that with a brain injury, with the right things, avoiding the avoidance, avoiding deconditioning, avoiding withdrawal, avoiding cogniphobia, right? Fixing all those indirect consequences or addressing all those indirect consequences of TBI, like pain, physical neck pain, cervical neck pain, mood disturbance, sleep disturbance, post traumatic stress, right? And if we can do those in a way and get you at a stable footing, right? We can move forward. And that's the optimistic thing about nothing that is progressive. And so it may take time, encouragement, and creativity, but individuals with TBI can reintegrate and recover with support, period.
Thank you for that. I think whenever something big happens in our lives that's scary, it can feel a little hopeless. It can feel like we're searching for that light. And so I think it's really, really helpful that you shared that recovery is possible, that things can improve, that these changes can be made. And I mean, you've just shared such valuable information.
Yeah.
And so my last
I
question, oh, go ahead.
oh yeah. I was just gonna say, right, yeah, and I was always fixated on the things in my brain scan. Right, I have this thing. What does it mean? What is it doing? And so it's not changing. But so like I was like, what is it? What is it? And then a neurologist at UCLA, whom I have the honor and privilege to work with, was telling me, well, whatever it is, it's obviously not a problem, right? And I was like, yeah, it's not a, and so I was fixating over this thing that not really a
Mhm.
problem. And
Right,
so,
right.
yeah, really a
Yeah,
great lesson.
yeah, absolutely. Um, and so my last
Yeah, last
question
question.
is, what would be, well, I guess it's a two-part question in one. So what would be
Okay.
one thing that you'd want to share with someone who has experienced an injury? And what would be one thing that you want to share with the people who are supporting that person?
Yeah, good. There is this, I think, uh, you know, I've heard people, I've spoken to hundreds, if not thousands, of survivors over the past decade. We have support groups every week, and getting to learn strategies. And so, if you're struggling or if you're wanting to connect to a community, we meet every week. And so, and we have been for years now. Actually, it's really a blessing. And so, through all of this, we've heard names for it like ambiguous loss, right? That we were talking about earlier. Like, oh, I look the same, but I feel different. But everyone else thinks I'm the same, so therefore it must be my problem. Also, I've heard call it the shaken sense of self. And so that and so if you're feeling like these, right? And so and I know I definitely felt this way, right? And so once you start having this second sense of self of like this discrepancy between how you look and how you feel, then anxiety starts to build, and then once you're trying to navigate and you have real genuine symptoms, cognitive symptoms from the brain injury, um, and so once those happen, you start withdrawing, and so depression deepens because you're isolated. And then mood distress, right? That feeds back into your social life. So all of your social encounters and your social functioning start, you start getting negative feedback. So you withdraw even more. And then that builds even more psychological distress. And then psychological distress in and of itself can produce secondary cognitive deficits. And then it starts over the whole cycle over and over and over again. And years can go by, and this negative feedback loop has now has engulfed you. And so it's so important to stay connected, reach out. Information, knowledge is key, knowledge is power. And how to approach the trials and tribulations of your life is that, I mean, really, that's, some people would call that's the exhilarations, right? We have to learn from those things and support each other through that. And so avoid the avoidance. I think avoiding withdrawal, avoiding isolation, because then once you start avoiding things, then you get cognitive disuse, and then you get deconditioned. And once you get deconditioned, then then you're really gonna have problems, right? So I mean, think of like you sprain your ankle or anything like that. You keep off of it for a little bit, but part of the treatment is you put weight on it. Right? So part of the treatment is you put weight on it, right? And so, there might be some findings on a brain scan. I got it too. But part of the treatment is to put weight on it. Avoid the avoidance. Engage, right? Look for connection, belongingness as you find safety in your school or in your family or in your neighborhood. And as you take steps towards feeling self-efficacious, self-agency, right? To that purpose, to pursue the purpose. And caregivers, I mean, family caregivers, phew, I can't even tell you, family caregivers, if any, beside the person, you might be the most important thing, right? I know mine was, as we all take steps together, um, with what seems to be overwhelming, but is actually but is actually possible, and you know uh, and is an important step towards connecting persons, finding safety in a place, as you move forward with self-agency towards a purpose. And so, yeah.
Thank you so much, Dr. Daniel. I mean, for your time, for joining us this afternoon, for sharing such important and very needed information about traumatic brain injury, but also explaining, the different types of injuries that can occur and how they can impact. Um, I know you are a very busy person and you are always giving to others. And so I really do appreciate you taking the time to spend with us. I think this has been really, really helpful and will help a lot of people. Um, and
Thank
for
you.
those of you who've
And
joined us, oh, go ahead. Yeah.
in closing, right? I want to say that support each other, but also remember, be careful on how you respond to difficulties. Be careful how you respond to the hands that you're given. Respond to the difficulties that you are blessed with. How you respond might become a reflection of who you might become.
I really like
So
that.
approach it with grace. So approach your problems with grace.
I couldn't agree more if I tried. So thank you so much. I think that's a beautiful thing for us to end with. And for those of you who've joined us this afternoon, we hope this information has been helpful to you. We will do this again next month, July 29th from 3 to 3:30. The topic next month will be what is hospice. So we'll be talking about hospice, what that means, kind of demystifying some of the things that I think we all have heard, and really getting to ask some questions about that service. And so again, thank you everyone for your time, and everyone please take good care and have a great rest of your week. And thank you again, Dr. Daniel.
Stay blessed.